This is TLC to go.
Welcome back to the Deep Dive, everyone. Today we're focusing intently on you, our health sciences faculty. We've pulled together some really practical strategies for effective teaching in the clinical setting, drawing directly from the wealth of resources at the UTHSC Teaching and Learning Center.
Yeah,
Think of this as like your streamlined guide to enhancing your teaching toolkit.
exactly. We know your time is valuable, so we've synthesized key approaches that you can, readily apply to your work with learners. Our aim is to move beyond simply describing these strategies and offer some insight into why they can be so impactful.
Okay, so what's on our radar today? We're going to start by looking at the often underestimated power of clearly setting expectations with your learners right from the outset. Then we'll explore the 1-minute preceptor, or OMP, a really efficient framework for those quick teaching moments during case presentations. Following that, we'll dive into SNAPs, a more learner-driven approach to case discussions that can give you valuable insights into their thinking. And finally, we'll touch on prediction exposure feedback, a method to actively engage students when they're with patients.
And all geared towards practical tips.
Right. All of this is geared towards providing you with actionable tips you can use, like immediately.
And as we discuss these, it's good to consider how they tap into fundamental principles of learning. For instance, clear expectations aren't just about logistics. They create a foundation of trust and clarity. That allows learners to focus on learning rather than navigating ambiguity.
Absolutely. So let's jump into setting expectations. The UTHSC TLC resource we looked at makes a really strong case for having a proactive discussion with your learners before their clinical rotation even begins. It's about creating a shared understanding from day one.
Right. When learners know what's expected of them, it just reduces anxiety and allows them to be more intentional in their learning. It's like giving them the syllabus for the clinical experience, really.
Yeah, exactly. And the TLC resource provides a pretty comprehensive checklist of topics to cover in this initial conversation. Of course, goals and learning objectives are key. What should the learner be able to do or know by the end? But it's much broader than that. You should also think about outlining your teaching methods.
Yeah.
How will you be guiding their learning? What kind of feedback will they receive and how often?
Yeah. And what's the day look like?
Exactly. What will a typical day look like? What are their clinical responsibilities?
Those practical details are so important. Learners often feel adrift if they don't understand the day-to-day flow and their role within it. And clarifying expectations around case presentations, like how detailed should they be? What format do you prefer? That can prevent a lot of stress.
Definitely. And things like note writing expectations, the chain of supervision, who do they go to for different issues, even preferred communication methods and any relevant institutional policies.
Covering those up front.
Yeah, covering these up front can really streamline the entire experience.
It's about creating a transparent learning environment. The TLC resource even points to a UAB Minute Moments video on this topic, underscoring its importance in the medical education community. While we won't watch it now, it's another validation of this crucial step.
And here's a really insightful tip from the TLC. Take some time before meeting your learners to actually write down your own expectations for their performance.
Oh, that's interesting.
Yeah, this act of self-reflection can help you identify assumptions you might not even realize you're making and ensures you cover all the essential aspects when you do connect with your learners.
That's a great point. It encourages a more thoughtful and structured approach to that initial meeting, moving beyond just a casual welcome to a purposeful laying of the groundwork for a successful learning experience.
Okay, so we've established the importance of setting expectations. Now let's move on to a really useful framework for those often brief but critical teaching moments in the clinic. The 1-minute preceptor, or OMP.
Right.
It's built around 5 micro-skills designed to efficiently assess and guide a learner's clinical reasoning.
What's particularly effective about OMP is its structured approach. It provides a mental checklist for faculty to quickly understand a learner's thinking and offer targeted feedback, all within a minute or two.
Exactly. The first step is straightforward. The learner gives you a concise summary of the patient's case, the key relevant details.
This initial summary provides a window into what the learner deems important and how they're organizing the information.
Then the second step is pivotal. You ask the learner to make a commitment. This could be asking for their leading diagnosis or what their next step in management would be.
This step is crucial because it forces the learner to articulate their current understanding and take a stand, so to speak. It moves beyond simply reciting facts to making a judgment.
And that directly leads to the third step, You ask them to provide the reasoning behind their commitment. What evidence supports their diagnosis or their proposed plan?
Okay, so here you're proving their understanding of the underlying pathophysiology, their ability to interpret clinical data, and their logical reasoning. It reveals the why behind their decision.
Right. Now comes the explicit teaching. In the fourth step, the faculty offers a generalizable teaching point. Based on the learner's presentation and reasoning, you share a broader principle or concept that applies beyond this specific case.
Yeah, the emphasis on generalizability is key. You're not just addressing the immediate situation, but equipping the learner with knowledge they can transfer to future, similar scenarios. The TLC resource really underscores this beautifully. Think about those pearls of wisdom you've accumulated. This is a perfect opportunity to share them.
Right. The tip here is to consciously think about how the teaching point extends beyond this particular patient. What's a rule of thumb or a key concept they can apply again and again?
And finally, the fifth step involves providing feedback, reinforcing what the learner did well, and offering constructive criticism on areas for improvement. It's that balanced approach that fosters growth.
Exactly. And the research, as the TLC resource highlights, indicates that OMP is indeed effective in sharpening clinical reasoning skills and encouraging more comprehensive consideration of different diagnoses. The TLC also mentions a handy one-pager for preceptors from the University of Kansas as a quick reminder of the 5 steps.
So OMP offers a structured yet efficient way to integrate teaching into the fast-paced clinical environment, focusing on the learner's reasoning process.
Okay, so we have OMP for those efficient, faculty-guided interactions. Now let's explore SNAPS, which takes a more learner-centered approach to case presentations.
Oh.
This framework really shifts the focus onto the learner's active participation and critical thinking.
What's particularly valuable about SNAPS, I think, is how it empowers the learner to take ownership of the discussion, revealing their thought process in a more transparent way.
Exactly. The acronym itself is a useful memory aid. SES stands for Summarize the Patient, providing a concise overview of the key clinical information.
Then N prompts the learner to narrow the differential diagnosis, articulating the potential conditions they're considering.
A is for Analyze the Differential, where the learner explains their reasoning for including certain diagnoses and excluding others. This is where their clinical judgment really comes into play.
And here's a key differentiator from OMP. P is for Probe the Faculty. The learner is expected to ask you questions about aspects of the case they're uncertain about, alternative diagnostic approaches, or management strategies.
Oh, interesting. So the learner asks the questions.
Exactly.
This active questioning is so important. It demonstrates their engagement and helps them identify their own knowledge gaps in real time. The next P is for Plan the Management, where they propose their approach to caring for the patient.
And finally, S stands for Select an Issue for Self-Study. This encourages a culture of continuous learning by prompting the learner to identify an area related to the case that they want to explore further independently.
Right. The TLC resource points out that by having the learner lead the discussion in this way, faculty gain a much clearer picture of their clinical reasoning process, making it easier to identify areas where they might need more support.
And the research cited by the TLC supports the benefits of SNAPS. Learners using this framework tend to generate a broader range of potential diagnoses, exhibit more detailed clinical reasoning in analyzing them, and crucially, are more likely to express their uncertainties.
That willingness to voice uncertainty is so valuable. It indicates a level of metacognition and a commitment to identifying and addressing their knowledge limitations.
Definitely.
And as that study we mentioned earlier confirms, both OMP and SNAPS contribute to improved clinical reasoning, albeit through different mechanisms.
In SNAPS, your role as faculty shifts somewhat. As the TLC highlights, you become more of a facilitator, guiding the conversation with your responses to the learner's questions and providing feedback, but allowing the learner to drive the direction and content of the discussion.
It fosters a more active and reciprocal learning environment, encouraging the learner to take greater responsibility for their own learning journey.
Precisely. It's about moving away from a purely didactic model to one where the learner is actively constructing their understanding through inquiry and analysis.
All right, we've looked at setting expectations and 2 key frameworks for case discussions. Now, let's consider another learner-centered approach specifically designed for engaging students during direct patient encounters, particularly in outpatient settings. Prediction exposure feedback.
Okay, this sounds useful for the clinic. This is a particularly useful technique for maximizing learning during those often brief interactions in a busy clinic. It focuses on activating the learner's thinking before they even see the patient.
Exactly. It involves 3 sequential steps. First, prediction. Before the student interacts with the patient, you ask them to predict something relevant to the case.
Like what?
Well, the TLC resource offers examples like predicting the diagnosis, expected lab results, or findings on a physical exam. The goal here, as the resource notes, is to tap into their existing knowledge base.
Okay, so by asking for a prediction, you're essentially prompting the learner to retrieve and apply what they already know, making the subsequent encounter more meaningful.
Exactly. Next is exposure. The student then sees the patient, has the opportunity to interact with them, and gather clinical information firsthand.
Right. This is where their initial predictions are tested against the reality of the clinical presentation.
And finally, feedback. After the encounter, you engage the student in a discussion about their prediction. Were they accurate? If not, what were the discrepancies? This provides an opportunity to correct any misconceptions and offer targeted feedback on their clinical reasoning.
That moment of comparing their prediction to the actual findings creates a powerful learning loop, reinforcing correct understanding and highlighting areas where their knowledge or reasoning needs refinement.
Exactly. By prompting a prediction up front, you're increasing the student's engagement during the patient encounter and making them more receptive to the feedback that follows. It's a really effective way to transform routine outpatient visits into valuable learning experiences.
It's about making every patient interaction a deliberate learning opportunity, even within the constraints of a busy clinical schedule.
So, as you can see, we've explored several practical strategies today, all supported by the resources at the UTHSC Teaching and Learning Center.
And it's important to reiterate that the TLC is a fantastic resource for you. They offer a wide array of support to enhance your teaching skills.
Absolutely. Beyond what we've discussed, the TLC library, their Teach Well, Learn Well, online resources, and their workshop library are all invaluable.
Yeah.
They also have TLC Connect, an academy of master educators, and resources on incorporating academic technologies into your teaching.
And for those looking for more in-depth professional development, the TLC offers programs like the Teaching Excellence Institute, Medallion Program, and the Future Educators Academy. And for faculty who work with residents, the GME Resident as Educator program is a great option.
And specifically for our clinical faculty, the TLC features the Clinical Educator Teaching Excellence Institute and the Clinical Educator Medallion. These are tailored to the unique needs and opportunities within the clinical teaching environment.
You can find a wealth of information on the TLC website, including a dedicated clinical faculty resource page. And if you have specific questions or want to connect directly, they are there to support your teaching endeavors.
So to bring it all together, we've taken a focused look at the importance of setting clear expectations with your learners and explored 3 distinct frameworks for enhancing teaching and fostering clinical reasoning in the clinical setting. The efficient faculty-led 1-minute preceptor,
Right.
the engaging learner-driven SNAPS framework,
Yep.
and prediction exposure feedback for active learning during patient encounters.
And the key takeaway here is the practical applicability of these strategies. They offer concrete steps you can take to make your teaching more impactful and to help your students develop the critical thinking skills they need to excel.
We highly encourage you to explore the resources available through the UTHSC Teaching and Learning Center to delve deeper into these and other effective teaching methodologies.
This brings us to a final thought for you, our dedicated health sciences faculty. As you reflect on your teaching practices, how might intentionally incorporating one of these frameworks, or perhaps just revisiting how you set expectations at the start of a rotation, positively shape your learners' development and their experience in their next clinical encounter?
Yeah, it's a question worth considering as you continue to guide the future of healthcare.